So in treating tumors, there's lots of different modalities. Most of us are familiar with chemotherapy, which tends to use very toxic agents that hopefully disproportionately treat the tumor, but we know they also can have an impact on healthy cells throughout the body. Unless you get the many common well-known side effects of chemotherapy, right? You may lose your hair, your GI lining, and have abdominal pain and diarrhea. So people have tried to develop therapies that are more targeted. In other words, really directing the therapy to the cells that need to be treated. And that's where other therapies such as peptide receptor radionucleotide therapies, which are commonly used in NETs, or antibody drug conjugates are also used. These are therapies that try to use often an antibody to target, to bring the therapeutic compound to the specific tumor cells. Now, the trouble with radionucleotide therapy is, it's radiation, and so as it's circulating in the body, other cells can be exposed. They sometimes can be complicated to deliver. You often have to be hospitalized, isolated from friends and family, and there's also a limitation on how much radiation dose you can get over time, so retreatment can be a problem. Antibody drug conjugates use an antibody to bring a payload to treat the tumor, again, to the tumor cells in preference to healthy cells. Those are good, although these antibodies are often big peptides that may have trouble penetrating deep into the tumors. They also survive for often weeks in the circulation, and the concern there is that maybe these peptides can break down over time and release their peptides outside the tumor. So non-peptide drug conjugates, or NDCs, are really one of the things that we are pioneering here at Crinetics as an investigational therapy for neuroendocrine tumors. These have many of the same advantages of ADCs, or antibody drug conjugates, but being a much smaller non-peptide molecule, they really circulate in the serum at a much reduced rate. So instead of lasting for up to weeks, they can be cleared rapidly within 24 hours and almost non-existent after 72 hours. They still target the payload to the specific cells on the tumor, and the payload does not become activated until this compound is internalized within the cell, thus reducing the exposure to non-tumor cells to the payload. Finally, because these are small molecules, they may do a better job at penetrating deep into the tumor to get more of the tissue we're really targeting.